Minister, I suppose there's a few points that have to be made. I know I'll get a historical lecture as to why we are where we are, but I mean we are in a very difficult position because I mean commitments have been made in the context of the HSE to address this particular issue. Now, it was highlighted in the service plan of 2013 that the HSE would make every effort to address the issue of the European Working Time Directive. Now, I suppose what I'm trying to find out here today is why we are at now the situation where the IMO and the non-consultant hospital doctors have no trust and no faith in the HSE in terms of actual commitment to resolving this particular issue, and only doing what is employment law, and that is to ensure that people work in a safe environment and that they are allowed periods of rest and they only work in a rostered period that is safe in providing the services. And quite clearly, when you look at the history of this, but more importantly, when you look at the last number of months and the breakdown of trust between the HSE and the IMO in the context of dealing with this, it really does raise a lot of questions. Now, I know that it has been before the Labour Relations Commission, and in fairness, the Labour Relations Commission has huge expertise in trying to bring about resolutions to industrial disputes, and has been doing so for many, many years. But the fact that they were unable to try, or were unable to bring about a resolution of this particular issue, would raise lots of questions as to why the HSE have not been able to enter into meaningful dialogue in a way that allows the non-consultant hospital doctors to believe the HSE. And I suppose, Minister, I have to ask the question in the context of the role of the HSE, and you saying that you are politically responsible for the HSE, that you are the person that has taken charge of that organisation. I'd like to know, do you trust the HSE completely in the context of the commitments that they have made with regard to implementing the European Working Time Directive for non-consultant hospital doctors? And I know that there's huge strains out there in the medical services. The non-consultant hospital doctors are an integral part of that. They provide huge, valuable service on a daily basis. But they are working under extreme conditions. And we have seen cases and heard cases. We saw people who are outside our hospitals today that have worked over 80 hours in a week in providing health care in this country. Now, everybody accepts it. Even, Minister, you said previously that the current working arrangements are in breach of European working time directives and were completely unacceptable. The HSE stated in their service plan of 2013, but yet we are now in a position where today we have 3,000 non-consultant hospital doctors who had to take action to encourage dialogue and to encourage a resolution of this. Now, the difficulty with all of that, of course, Minister, is that we now have huge swathes of people who depend on the health services in this country and non-consultant hospital doctors to provide the care. We've had 12,000 outpatient deferrals. We've had 3,000 elective surgeries deferred. And that puts huge pressure on the individuals themselves. Is it 3,000 procedures were deferred today because of this particular action? 12,000 outpatient appointments deferred as well. Well, they're the figures that I've given, so I hope that you can correct that. But even if there was no deferral, the point is that we still have 3,000 people who have no faith in their employers in bringing about what is their entitlement under European law. And I know, Minister, as I said, you will give me the historical lecture on it, but I mean, we are now in a position where we have a complete breakdown of trust. And I would urge everybody to go back, obviously, to the Labour Relations Commission to try and see can this issue be resolved. But in the meantime, as political head of the HSE, you have to surely ask the HSE the question, why has trust broken down? And do you have faith in the HSE in terms of how they've negotiated so far with the IMO on behalf of the non-consultant hospital?
Thank you, Deputy Minister. 4 minutes.
Thank you very much. The Deputy, of course, opens his comments talking about a historical lecture because he doesn't want to be reminded of the true history. But I won't focus on that. I will come to it later, obviously, but because I think it's important. I think what's really important here today is to say that, I mean, I share the concerns that people have about this action that's taking place today and the disruption to the delivery of acute care and the unnecessary worry and anxiety to patients that's caused. And just to correct the figures that are out there, and I don't have the absolute accuracy, but no more than 7,400 patients have been affected by this. That's 7,400 patients more than should have been affected, because this action, in my view, will not help the situation. I believe that junior doctors have a right to reasonable working hours, and their patients have a right to feel safe in their care. And I don't believe it's safe to have doctors working the sort of hours that they've been asked to work in the past. And we all must work together towards reaching a safe solution. And the point is, we have made major progress in tackling this long-standing problem. And long-standing it is, as the Taoiseach told you earlier on. Here's a report from 2001 commissioned by your leader, Deputy Micheál Martin, in January 2001 at a cost of 254,000. And here we are in 2013. Now, at my request, the HSE established a national group in February this year to bring an urgent focus to implementation of the Working Time Directive. I've met with Commissioner Andor on a number of occasions on this. And this group has made progress in relation to the number of doctors working more than 24 hours in a single shift and the instances of doctors working more than 68 hours per week. The average hours of an NCHD is now declining. Previous surveys have shown that the average working hours for NCHDs fell from 60 hours a week in 2009, notwithstanding the fact that your initial report in 2001 wanted under 48, to 54 hours a week in 2012, and during the first 6 months of this year it fell to a further 52.4. And I'm not saying that that's enough. It must come down the rest of the way. Furthermore, the proportion of NCHDs working shifts in excess of 24 hours has fallen from 58% in March of this year to 34% in August. It's still too many, and more must and will be done. But we are making serious progress. In addition, I did set up a group chaired by the President of DCU to carry out a strategic review of the medical training and career structure of NCHDs with a view to improving retention of graduates in the public health system. An interim report is to be provided in November. The establishment of the hospital groups will empower hospitals to cooperate and share NCHDs when scarcities arise. This will further reduce the average of NCHDs hours. Compliance issues arise largely in particular specialities. Virtually all NCHDs in radiology, emergency medicine and psychiatry are fully compliant. Following discussions at the LRC over recent weeks, a joint IMO-HSE verification and implementation process has been proposed. This has already begun and will be proceeding during October. Action to change rosters and revise work practices identified during this process will be implemented during November. Implementation and achievement of a maximum 24-hour shift will then be verified jointly by the HSE and the IMO. There's clearly going to be a reduction in planned patient attendances. It is estimated that cancellations will arise, as I said, in respect of about 7,000. The patients deferred are being offered the earliest possible reattendance dates. It's already government policy that those waiting longest for treatment should be prioritised. The IMO has confirmed that the same level of staffing cover as is normally provided on a Sunday will be in place. It's also undertaken to provide all necessary urgent care as well as oncology, dialysis and transplantation.
Minister, the remainder of your reply can be read into the record.
Okay, can I just finish, and I won't read the rest of the reply, to say that we are very keen to resolve this issue. We're very keen to have clear sanctions in place. The HSE have invited the IMO back to the LRC tomorrow to discuss all manner of sanctions, and I personally have already made the statement that I want to see the sanctions aimed at those who have failed, not patients, not doctors and not hospitals themselves, but rather the management that fails to deliver.
Deputy Kelleher, 2 minutes.
Thanks, Kelleher. Well, just to say, look, Minister, I mean, the report was commissioned in 2001. This is now 2013. We didn't have or haven't had a junior doctor strike in 25 years, but we have one today. And that is the difficulty. So whether it is previous incumbents of your post or otherwise, we didn't actually have industrial disputes of this nature. We now have a situation where over 3,000 non-consultant hospital doctors are outside our hospitals today, and it is impacting on the delivery of health care. And we all accept that junior doctors have an integral role to play in the provision of health care in this country. They are the bulwark, actually, of our health services. They do a huge amount of work. But the point being is, you have stated yourself personally that the working arrangements are just not satisfactory. And I know you've commissioned reports, and you're commissioning an individual to report back to us with regard to clear pathways, training, and what is required to attract, retain our non-consultant hospital doctors, and to provide clear pathways for them in the years ahead with regard to training and career options. And I accept all of that as very positive. But in the meantime, there's been a fundamental breakdown in trust. And what I'm asking you, Minister, is why has that happened? Is it that the HSE are dragging their feet? Is it that management in some areas of the HSE are just not cooperating in terms of addressing the European Working Time Directive? Because we have cases where in some hospitals it is being implemented. The rostering is being implemented to accommodate and to comply with the European Working Time Directive. And in other areas we don't have that. So clearly, Minister, it is the HSE have a major problem in trying to deal with this, and trust has completely broken down between the two sides. And the key question is, why is that the case? And are you fully confident, and is your full support in the HSE in dealing with this issue? Because that is critically important. The non-consultant hospital doctors don't have faith in them. They have expressed that on a number of occasions. They don't believe that there is commitment to sanctions for those hospitals that fail to implement the European Working Time Directive. So from your point of view, do you have full faith in the HSE management to address this particular issue and get our junior doctors back to work?
Thank you. Minister, 2 minutes.
Thanks very much. Well, the Deputy has posed a lot of questions there. One of them, of course, is why there's no trust. And the reason there's no trust is that too many dawns have passed and come and gone, and this issue has not been addressed. And you know, what was done in the past was just throw money at it instead of actually reforming the system. Now, we don't have money to throw at it, as you well know, for reasons that are well known to everyone in this country. But we are reforming the system to address that issue of allowing doctors a safe work practice so they can deliver safely for their patients. You've asked, I mean, I'll just make a few notes here about, you've acknowledged that some hospitals are indeed compliant, and yet all hospitals are affected by this. I think this is an understandable expression of frustration by non-consultant hospital doctors at what they see as inhuman working hours, lack of a clear career path, and facing exhaustion, and at the end of it all, what will they have to show for it? It's so difficult to ensure how one becomes a specialist in this country, with our training times taking on average 12 years, which is far too long. Can I say to you, though, you've asked me, do I have faith in the HSE and their management of this situation? I have faith in the new HSE management. I have faith in Mr. Barry O'Brien, who is the new HR man, and I have faith in Mr. Tony O'Brien and his new management and directors of management. So I believe this can be resolved. I'd use this opportunity again to appeal to the IMO NCHDs to come back to the LRC to resolve this issue. It won't be resolved on the picket line. It won't be resolved by hurting those whom they want to care for and give safe care to. And I understand that, and I appreciate that. And again, as I've said in this House, I appreciate and I respect our young doctors. They're going to be the specialists and GPs of tomorrow. And I would ask them to come back to the table to sort this problem out in a manner which will give them the reassurance that those who fail to provide will be the ones who will suffer, not patients and not doctors. And furthermore, that they will have a bright and a clear future in this country in medicine, as we clarify through Brian McGrath's group the career path for our future specialists and GPs. Thank you.